Hi there, I'm Dr. Beech. In today's video I want to talk a little bit about posture. The reason that posture is important is because bad posture, meaning that we're not in alignment with the way that our body is structured, puts a lot of stress on the body and is the cause of a lot of chronic pain. So when patients come in to see me and they have a chronic pain problem, so it's not like a car accident or they fell or something like that, it's some pain that they've had for months and even years, maybe decades. One of the things that I always look at is how is their body structured? How is the biomechanics, or what we normally call posture, doing? And so I have a special program where I take a picture of the patient from the front and the side, and then I put that in a computer program, and I can look to see how their alignment is. And so when a patient has bad posture, there's certain typical findings that we'll see. One of those is that many times they'll arch the low back too much, what we call sway back, where the back is being arched too much. And then also they'll have something what we call forward head tilt, where the head is jutting out to the front. This is typically not noticed by the patient because you have to look at yourself from the side to see it. So since we don't do that, we don't typically notice that particular thing. The other aspects of posture, looking from the front, would be that the hips might be unlevel. So like one side might be lower or higher than the other. Same thing with the shoulders might be out. Head might be to one side, the other side, or tilted to one way or the other. Those kinds of findings we look for. And then we have to figure out how to fix that. And my experience has been over the years that most posture problems are caused by imbalances in the feet. Now I have another video where I talked a little bit about orthotics. And the reason that's why we use orthotics is because the feet are often involved. And the reason for that is that the feet provide a foundation for the rest of the body. I tell my patients that we're basically a stick on stilts with a bowling ball balancing on top. And all of this has to be balanced by the feet. If the arches in the feet have either fallen, which is called foot pronation, where the arch falls and the foot rolls in, or if it supinates, meaning it rolls out too much beyond normal, either of those positions, and pronation is by far the most common one, will cause our body to go out of center of gravity. So what I mean is that if our feet roll in, if we have foot pronation because the arches are falling or the feet are totally flat, that will cause the body to go forward ahead of our center of gravity. Now, center of gravity is extremely important. We are very, very sophisticated creatures in terms of center of gravity because of what I said. We're basically a stick on stilts with a bowling ball balancing on top. If you've ever noticed the squirrels running across the fence line or across the telephone wires and marvel at how they do that, I think they probably sit in the trees and marvel at how we walk upright. It's that sophisticated what we do. And because of that, if we're out of our center of gravity, then what occurs is we have to do one of two things: either adjust our posture to get back into center of gravity, or try to stand up out of center of gravity, which is impossible to do for a long period of time because it violates that law of physics of conservation of energy. We'll literally run out of energy trying to stand up. So try it sometime. Just lean forward ahead of your center of gravity and see how long you can stay there. It doesn't feel comfortable, and that feeling that it's not comfortable is your brain writing that mechanism in the brain that wants to bring us back into our center of gravity. So when the feet roll in and our center of gravity is pushed forward, we will automatically arch our back to come back over our center. And then, because now our head is too far back and we're out of center of gravity there, the head will come forward like this in order to get us back into a nice center position. And so the problem comes in correcting posture. We have to look at those causes. And so what we do is we look at what the posture is, what the stresses are on the body, and then design a program to correct the cause, which is in many cases the feet, and any other aggravating factors that might be there. And then over a period typically of about 20 visits, I can usually correct a person's posture to the point that it's taken a lot of stress, and typically the chronic pain. So by taking the chronic stresses off of the spine, by correcting the posture and the biomechanics, that stops the pain, the chronic pain that the patient's typically been feeling for a number of years. And I've been using this technique now for decades and found it to be an extremely effective means of treating chronic neck and back pain. So if you have any of these problems or you're just curious about what your posture is like, then please give us a call, make an appointment, and come in. I'm happy to check it and go over it with you and discuss what your options, your individual options could be for care. Thank you.